Cardiovascular disease is a complex and multifactorial condition that affects millions of people worldwide. It encompasses a range of disorders that affect the heart and blood vessels, including coronary artery disease, heart failure, and stroke. Despite advances in modern medicine, cardiovascular disease remains a leading cause of death globally, underscoring the urgent need for effective prevention and treatment strategies. The pathogenesis of cardiovascular disease is multifaceted and involves a combination of genetic, environmental, and lifestyle factors. The risk of developing cardiovascular disease increases with age, and certain genetic predispositions can also increase the likelihood of developing the condition. Additionally, lifestyle factors such as smoking, poor diet, and lack of exercise can significantly increase the risk of developing cardiovascular disease. One of the hallmark features of cardiovascular disease is the presence of atherosclerosis, a condition characterized by the buildup of fatty deposits on the inner walls of the arteries. These deposits, also known as plaques, can cause the arteries to narrow, reducing blood flow to the heart and other organs. This can lead to a range of symptoms, including chest pain, shortness of breath, and fatigue. In addition to atherosclerosis, other factors can contribute to the development of cardiovascular disease. For example, hypertension, or high blood pressure, is a major risk factor for heart disease and stroke. Other risk factors include diabetes, obesity, and a family history of cardiovascular disease. The diagnosis of cardiovascular disease typically involves a combination of physical exams, blood tests, and imaging studies. For example, a stress test can help identify blockages in the coronary arteries, while an electrocardiogram, ECG, can detect abnormalities in heart rhythm. Additionally, imaging studies such as echocardiography and cardiac catheterization can provide detailed information about the structure and function of the heart and blood vessels. Treatment for cardiovascular disease depends on the specific type and severity of the condition. In some cases, lifestyle modifications such as diet and exercise can help reduce the risk of developing cardiovascular disease. For more severe cases, medications such as cholesterol-lowering drugs, antihypertensive agents, and blood thinners may be necessary. In some cases, invasive procedures such as angioplasty or bypass surgery may be required to restore blood flow to the heart. Despite the significant progress made in the prevention and treatment of cardiovascular disease, there is still much to be learned about the underlying mechanisms of the condition. Ongoing research efforts are focused on understanding the complex interactions between genetics, environment, and lifestyle factors that contribute to the development of cardiovascular disease. Additionally, researchers are exploring new treatment approaches that target the underlying molecular and cellular processes that contribute to the pathogenesis of the condition. In conclusion, cardiovascular disease is a complex and multifactorial condition that remains a leading cause of death worldwide. The condition is characterized by a range of disorders that affect the heart and blood vessels and is influenced by a combination of genetic, environmental, and lifestyle factors. Diagnosis and treatment of cardiovascular disease require a comprehensive approach that considers the specific type and severity of the condition, as well as the individual patient's overall health and medical history. Ongoing research efforts are focused on understanding the underlying mechanisms of the condition and developing new treatment approaches that can improve patient outcomes and reduce the burden of this devastating disease.